Welcome to Parev TV. Our guest is cardiologist Dr. Ani Nalbandian. Before I continue, Ani, I know you're a very busy person. I know we've tried to get this interview with you for some time, and I really respect that aspect of your life. And just to thank you again for giving us your time and talking to us. You are not just a cardiology doctor, you have earned your fellowship. We may not understand exactly what is a fellowship. Maybe you can explain to us, after many years of medical school, etc., you have earned your fellowship and also you have been awarded for the work you have done. And this is really a great honor for you, for your family, and for the Armenian community. Um, we plan to do two things in this interview, Ani, if you can help us. One is to learn more about how to avoid set heart diseases, possibly. And the other one is tell us, what did it take? It takes a lot of patience, energy, hard work to achieve the goals you have achieved. So once again, congratulations. Could you give us an idea what, in very simple words, because I was recently at the cardiology office and we all have questions with cholesterol, with blood pressures. We go on treadmills, we have nuclear injections, all this. This week I had and I passed with flying colors. But what are simple rules we can take to avoid heart diseases?
hmm Well, first of all, thank you so much. It's truly a joy and honor to have this opportunity. Your outreach is really quite remarkable, and I think our larger Armenian community, as well as individuals, really appreciate what you do and the uniqueness of what you do. Sincerely said. To answer your questions, somewhat sequentially, so just very briefly about what it takes to become a cardiologist, because I think that helps frame the context when someone does go to see their cardiologist as well, the background and the training and the perspective that a cardiologist has. And yes, it's very confusing, all the jargon. But once one graduates medical school, you do have your medical degree. But here you're not able to practice without having had what's called a residency,
Hmm.
which is the actual clinical training and the opportunity to really bring what you've learned in the classroom as a medical student to fruition. So in the United States, you cannot practice just with a medical degree in whatever subspecialty you're going to pursue, whether it's orthopedic surgery or internal medicine or pediatrics or psychiatry. You have a set number of years of residency for that specialty. Now, I did internal medicine training, which is basically an adult, general medicine or internist.
Hmm.
And then that is the pathway, the common pathway to then pursuing a subspecialty. So residency, internal medicine is 3 years. And then if one chooses to, let's say, do cardiology or gastroenterology or infectious diseases, that is then called fellowship. And so for cardiology, it's an additional mandatory 3 years here in the United States. And so that's 6 years of postgraduate training, post your medical degree. And that's what then allows you to be a cardiologist. Of course, with that, there's board credentials one has to also obtain. In my case, I did a 4th year of cardiology fellowship where I did research. I was at a very academic program, so many of us do 4 years.
Hmm.
I earned a master's degree in patient-oriented research at the same time. And then after that, I did yet another fellowship, which is separate, which is critical care medicine. So I did, yes, yet another subspecialty within medicine beyond the general medicine doctor, which allows me to really practice in the intensive care unit setting. So I have multiple hats. And that's what fellowship is. It's subspecialty training and expertise beyond the residency training. Hopefully that's clear.
I think it's not clear. It's just amazing. How many years does it take? Because many kids from high school say, "I want to be an astronaut. I want to be a cardiologist, a plastic surgeon," but then they fizzle out. They kind of realize how many years it takes. Overall, how many years has it taken you to get to where you are after high school?
Yes, it's many years. And I'll say this is the one thing that I knew very clearly. I was 5 years old. I didn't come from a family of anyone being in the medical profession, but this I knew when I was 5 that I wanted to become a doctor. And my father teases me. He says, Ani, we thought that, just like people say they want to be an astronaut, we thought it was a phase, but that was my North Star always. So it takes, 4 years bachelor's degree, 4 years medical school. Then I did a total of 3 years internal medicine plus 4 years cardiology plus another year critical care. So if you add that up, it is quite a long haul. It's a marathon. And yes, being a physician, it doesn't really end there. There's every couple of years you have recertifications and so forth. It is lifelong learning, and it really does require one to know this is a profession, because it's not a 9 to 5, it's not an 8 to 5 job. It's constant, and but it's very rewarding. You do sincerely and profoundly impact people's lives.
You speak about this marathon, and I would like you to address your message to young Armenian boys and girls, high school graduates. What does it take? It takes a lot of what?
Certainly it takes passion, and it takes resilience, and it takes keeping one's eye on the ball, which is not immediate at all. The irony is, I mean, I have been a student for much of my life
Mm.
and the medical training. I still see that I will continue to remain a student in an unofficial sense, right? I'm not going to courses anymore, but you still have to constantly learn. It takes a lot of introspection, I think, as well, because if one is looking for a high-paying job and to finish their training and just move into the workforce quickly, that's not medicine. Medicine is years of training, it's years of practical experience, it's years of being evaluated. You're constantly receiving feedback by your mentors, by the training programs, and you're constantly taking exams. So it really does require tenacity and grit and passion for the field. It's not something that you'll be done in practicing in your middle of your 20s. You have many years ahead of you. So whenever I do advise students, at different phases, both those that are in undergrad, those that have finished undergrad and are waiting to apply to medical school, and even those that are in medical school, because I do interview at different phases. Now I interview more for those applying for residency in cardiology subspecialties, but I do ask these questions, which is really the most important question is for one to ask of themselves, is this what they want to do, knowing it's a commitment and it will require much sacrifice. Not that other professions don't, but the degree of the sacrifices of this are unique and are truly unending. And so if this is what the passion is there for, then go for it. But just recognize it is a marathon and not a sprint.
Uh, we all want to live healthily. We all want to take care of our health. Sometimes we turn to do wrong things to not help us live healthily. But what are some basic lifestyle changes you can recommend to avoid heart disease, to avoid poor health? What is it, your guidance?
Mhm. Well, we're very fortunate in the current era in which we live. There's really an abundance of knowledge, in particular when it comes to cardiology, because it's been so research heavy. Many of the medications that we now are very commonly utilized, whether that's statins or beta blockers, the antihypertensive medications, these all have now been around for decades and they're very tried and true. These were not present, let's say, in my grandparents' generation. So the field of cardiology and the fund of knowledge, and then we have also interventions that can be done, are really vastly expanded in the past few decades. The basics, though, at the same time, really come down to being active, physically active. So even just 20 minutes a day of walking, or of being in the pool, whatever is appropriate for that individual's. Every person, somebody have back pain, somebody has, certain limitations, but 20 minutes a day of exercise where you get your heart rate up And it should be an exercise where you are not, meandering about doing exercise, but focused, devoted time, where that's where your head is at. And then also being very health conscious with regards to what we eat, which it really does come back to the Mediterranean diet, which many of us in the Armenian community already have. So being very vegetable and certainly having a balanced diet, but having, for example, for breakfast, if one has some cucumbers, some varung, some lolig, and a little bit of, olives, and having more of an olive oil based diet, staying away from the fast foods, staying away from heavy meats, and just everything in moderation. That really is, and less processed foods. And also, very importantly, as a cardiologist, really focusing on daily salt intake.
Mm.
So, this I tell all my patients, and I start off by asking them, are you cooking your meals with salt? And they may say yes. And I say, that's the first thing. Don't cook the meals with salt. Every person has a different threshold of how much daily salt intake they should. Then I ask them what type of snacks, what type of food, is it processed? Is there deli meat? Deli meat is laden with salt.
Mm.
Anything that has a long shelf life, if you pick it up and you read the labels, it has salt as a preservative in it. So and snacks, for example, it should be more fruits and vegetables rather than a bag of chips. So the daily threshold of salt, even without us adding salt into our food, is already exceeded in many cases just by nature of today's lifestyle. So that's one important thing, which I think if we just stick literally to our roots, our Mediterranean roots, and seeking that, that's the proper food regimen to have. It actually simplifies things, and it's also much more pleasurable and cost effective as well.
I have a friend who runs every day 6 miles, is in the best of shape, around 60 years old, and he
Mhm.
always brags about his health and how healthy he is. And one day he had to go to a cardiologist, get on the machine, and 5 minutes later, they stopped the machine. They said, "You better be rushed to the hospital because there are serious problems in question." And the first thing they had to do was, which is the best Armenian doctor, especially at Columbia University. But Columbia is, of course, the place to look for the best. And you are the finest of the best, honestly, Ani. So let me ask you, what is it that we can do as a community to help each other? What do you advise a person? Where do you advise the person to turn to look for help? How does it work? Suddenly you're faced with this overwhelming problem.
Yes, definitely. And that's what's scary about heart disease is people can maintain a healthy lifestyle. A certain component of it is underlying genetics, certainly, as well
Mm-hmm.
as age, because age is an independent risk factor. As we get older, our bodies will change, and of course, the cholesterol plaque buildup also does occur over time. I think the most important thing is prevention. But of course, once we get to a point where we have actual disease and we need therapies, there are very, very many excellent facilities throughout the tri-state area in cardiology. Obviously, I have some bias being at Columbia and having done all my medical training there, but when it comes to the cardiac subspecialty, both with regards to cardiac surgery and then also the interventional cardiology, EP, electrophysiology, et cetera, heart failure, Columbia is uniquely poised in that it often is a pioneer in the field. It has this
Mm-hmm.
long track record of having these clinical trials in different areas. For example, in particular, in interventional cardiology, and setting the pace for the rest of the field. And I think that's what is really unique about Columbia, because when it's somebody's being evaluated for a cardiac procedure, whether it's via the interventional cardiology team or the heart surgeons, it requires many aspects. It requires the anesthesiologist, it requires the nursing care. It's a very well-oiled machine, as we say at Columbia. And of course, you have very excellent physicians with significant expertise, good clinical acumen, research capabilities, and that's what makes it a remarkable environment and why I've enjoyed being there all these years.
You know, mm, every doctor asks for family history. But
Mhm.
whenever I'm asked about family history, I think of my parents whose life was completely different than mine, who had to
Mhm.
go through very difficult times, be it pressure, different pressure, employment, family taken care of. So, what is the correlation between family history to the individual's history?
Yes, that's an excellent question. So, the reason why we ask about family history, and in particular with the cardiology lens on, is because there are definitely certain cardiac abnormalities that are genetically linked. And for example, we say things like if did anybody in your family have sudden cardiac death at an early age? So, there's entities where sometimes patients will say, "Oh, yes, I had a first degree relative who died suddenly in their mid 20s or 30s." That's very unusual, as we all know. And in some cases, we know what the cause was. Somebody will say an autopsy was performed, and but it raises our level of concern and suspicion that there's some other underlying genetic abnormality or a structural abnormality, and then that is a tip off for us to then screen that individual differently. So you might be more thorough, let's say, with certain imaging modalities to assess was there an aortic aneurysm, et cetera. Do we have to run some genetic tests, which in the general population you would otherwise not do. So that's why, especially with cardiac disease, there are certain things that can be found early on and that we can then risk modify or screen for or intervene upon at an earlier stage, which we otherwise would not do for the 330 million people living in the United States.
Ani հայերենով էդի խոսենք,
Անշուշտ։
հակիդեմ հայերեն գադարյալ է, թուք ընձակ Նալբանդյանին, աղջիկնեք դեր ընձակ Նալբանդյանի, սետա Նալբանդյանին, եւ գրնաս քաղուտը լավ գճանչնաս, գիտես ինչպես գսկա քաղուտը եւ գեդեվի քաղուտը, երբ հաջողության բսակված անցմը բժիշկուհիմը կամ բժիշկը հասնի այդ բարձունքներուն։ Մենք բոլորս կհբարդանանք, գու հաղթանակը ծևով մեր հաղթանակն է, անգերց։ Հարցը այն է, թե ինչ էր ձեր փորձառություններ հայկական նախնական դարիներուն եւ հետո ճամփորդած եք որոշ դեղեր հետաքրքրական է Հայաստան եղած եք
Այո,
քանի անգամ
4 անգամ,
4
անցյալ, այո։
ուրեմն ինչն է որ աստած է քեզ իբրև անց իբրև շգուի հայկամուտ ինչպես կդեսնակ ինչ է կարևորությունը շեշտել բացարձումն է
Այո, այո, մերսի։ Այո, so ես մեծ սա քնեցիկետի քաութին մեջ եւ շատ հստակորեն գիհիշեմ մանկությանս ադեն, որ բաբայիս հետ մեր քաութի անդամներուն տունը գայցել է եւ դարբեր այսինքն ես միշտ տեսած եմ մեր քաութը մեր ընտանիքն է, մեր հարազատներն են։
բրավո
And այդպես իրավ չերմորեն գսկամ եւ ես գիհիշեմ բիզիգուց գսեի որ գուզեմ ես փոլորին օգտակար դառնալ ադիկա մեջսներ չեմ գիտեր թե շատ ավելի աստվեցա որտեվ հայրս քահանա էր բայց միշտ տեսա որ իրարու մենք իրարու գրնակեցանք գրնամասել ես երիտասարդ յազադենս օրինակ հայ բժիշկներ կային մեր քաութին մեջ երբ որ գիտեին, որ ես կուզեի բժիշկուհի լալ, գերտայի իրենց օֆիսին մեջ այդ opportunity-ները ինձ դվին, որ ես տեսնեմ, թե ինչ է բժիշկը լալը։ Վերջին, բայց ես երբ որ համալսարան էի, even though միշտ գիտեի, որ կուզեի բժիշկուհի լալ, նույն ադենալ, օրինակ ես history major էի, pre-medical history major, համալսարանի դարիներուս, որտեվ շատ ուրիշ բաներ ալ գիտեի, որ ինձ you know գուրախացնեն եւ աթհավեսը ունե ուրիշ բաներ սորվելու եւ երբ որ ներողություն բժշկության համասարանեն առաջ այդ ճամփան բռնեցի գիտեի որ ադիկա երկար փարակ ճամփա է սոսի որ կուզեմ քիչ ուրիշ բաներ ադեսնել աշխարհի մեջ մանավանդ ծնողքս հոս չեն մեծած եւ իրենց պատմությունները եւ մեր քաութին պատմությունները միշտ լսած է թե ինչպես է ցանկին համը դարբեր է ամերիկայեն դուրս So այն ադեն Երուսաղեմ կացի աբրեցա եւ Սրբոց Սարգմանչած վարշարանի մեջ
Աբրեցար Երուսաղեմ
այո
որքան ժամանակ
6 ամիս
Wow
այո Դա բժշկության համալսարանեն առաջ էր, դարբեր օրերին, բացառիկ օրերին, հոն ա, թարգմանչած, սրբոց թարգմանչած վարժարանի մեջ գամավոր ուսուցիչ էի,
Hı.
մանկապարտեզեն մինչև 12-րդ հասարան դպրոց մնացի, բայց մեր հայկավուտը հոն սպիրկը դեսա, անշուշտ ամերիկահայ սպիրկը չէր, բայց Երուսաղեմի սպիրկը, որ շատ մոդիկ սկացի իրենց հանդեպ, Եվ աչքս բացվեցավ շատ, ինչպես տարբեր է, ուսումը ուրիշ երկրի մեջ, ինչպես տարբեր է հայկական քաղուտը ուրիշ երկրի մեջ։ Վերջեն, բայց երբ որ Ամերիկա վերադարձա եւ բժշկության համալսարան մտա եւ այս բան ընթացքին տարբեր առիթներ ունեցա, օրինակ առաջին ամառը բժշկության համալսարանի մեջ կացի Հունաստան 2 ամիս հոնալ ապրեցա հույն բժիշկի հետ
Hı.
աշխատեցա հիվանդանոցի մեջ եւ ալտեսա հոն ինչպես այո գրնալավ որ ամեն վերջին տեխնոլոգին իրենք ճունին ինչպես որ հոսունին Ամերիկայի մեջ բայց թեր բժշկությունը շատ լավ է եւ վերջենալ Հայաստան կացերեմ 4 անգամ կյանքիս մեջ եւ երթալեն աստարիներ ընթացքին գաբեր ունեցած է մեր հայ բժիշկներու հետ եւ մեր հայ սրտապաններու հետ եւ վիրապուշներու հետ եւ օհագի կրնամ ասել ամին բացարիք մենք դահանտ ունենք մեր ասկը
Bravo.
որբես բժիշկներ որբես բայց անշուշտ մեր խնդիրը միշտ եղած է մեր թիվը քիչ է բայց դահանտը հոն է եւ գիտությունը հոն է եւ Ես կգարձեմ, որ Հայաստանի համար հույսս այն է, որ аз վերջին անգամ ապրիլ 2024-ին հոնեի, միշտ ուխտարած էի, որ ապրիլ 24-ին դարի մը ներկա գուզեմ լալ, սոնցիալ ապրիլ 24-ին ներկա էի, եւ մի քանի օր անցուցի երկրին մեջ, բայց ամեն անգամ, որ հոն կերտամ, իմ ավելի կտեսնեմ երիտասարդները ավելի կձխեն։ And so ինձի համար, it's like at bars prevention բաները, որ ձխել օրինակ շատ վատ բան է, գիտենք, it damages the heart health, the lung health, բայց ադիգա, there's basic prevention things, որ կարծեմ հոն թեր պետք է իդ, որ Հայաստանի համար գետրոնանանք, գիտությունը գա, դահանտը գա, to do complex procedures, բայց prevention-ը կարևոր է եւ ադիգա չենք գնար փախսնել այդ առիթները։
Երեսանի շատ գրդանք խոսիլ եւ նպատակս ավելի ցեզ զանոթանալի ցեզ զանոթացնել քաղուտին է ադե նպատակը եւ պետք է շեշտեմ այստեղ մեր ասկին բացությունը եթե հետևինք գտեսնանք մեր գլխավոր առաջնորդները եղած էին բժիշկներ որոնք ասկային ոգիով դոկորված էին, այսինքն ասկային ոգի գարած բժիշկներու մեջ։ Մեր բոլոր ղեկավարները բժիշկներ եղած էին եւ մտավորական դարեր։ Անշուշտ Ամերիկայի մեջ տեխնոլոգին փոխեց ամեն բան, հիմա մի քիչ տրամն է գխոսի, բայց բժիշկներու այդ ոգին եւ կարողությունը չանդեսենք, ամեն բան դեղ ունի։ Այնպես որ միա վերջին հարցումս այն էր թե եթե մեկը ծեր հետ գապ գուզե բահել is it Colombia համալսարան պետք է կամ գաբդվի կամ դուք practice ունիք զադեն ինչպես է ծեր հետ գապվիլը
Անշուշ, այո, իմ practice-ս Կոլումբիայի cardiology division-ին մեջն է, so իմ ուրվես հիվանդներ կտեսնեմ is in the main campus, Կոլումբիայի So on Gernan Kal Mivatner website on the Division of Cardiology page. Yes, in Tanrab is general cardiology, Hivaner Gedestem, so all different adults, Mian Medzeru, which pediatric, so all different entities, Ivan Tuchuner, Gam general cardiologist Mega Uzene and Zigernan Kal, and then yet the sancte interventional procedure, I work in tandem with those subspecialists. So it's very hajeliye you've shot mitzbadivet to be anybody's cardiologist. So I always advocate as strongly as I can.
Մեզի համար բադիվ ունենալ ցեզ նման դաղանտաշատ բժշկուիմը եւ հաջողություն կմաղթենք ուրիշ չէ գարձեմ դուք դակավին նոր գսկսիկ գործեր գյանքի մեջ այս բժշկությունը եւ շատ պիտի լսենք ցեր մասին հաջողություն կմաղթենք ուրիշ ոչինչ
Շատ մերսի